The 28th of July each year is recognized as the World Hepatitis Day. And for 2025, the theme is Let's Break It Down. So join me as we look at the key facts and issues related to hepatitis. Now, the theme for this year, as I said, is Let's Break It Down, and it calls for urgent action to dismantle the financial, social, and systemic barriers, including stigma, that stand in the way of hepatitis elimination and liver cancer prevention. You know that hepatitis involves the liver, and the liver is an organ that is only one in the body. It's not paired like what you have in the kidneys and the eyes and some other organs in the body. So what happens is that when you have hepatitis, the liver gets inflamed, it gets enlarged, and may lose its function over time. And one of the things that challenges the management of hepatitis is the stigma that follows it, especially when you have the form of hepatitis that's associated with infections like hepatitis B and C. And this stands in the way of hepatitis elimination and liver cancer prevention. Now let's look at some facts. It will shock you by the time we look at the statistics. 304 million people are living with chronic hepatitis B and C. This was as at 2022. And only 45% of babies received the hepatitis B vaccine within 24 hours of birth in 2022. Now, this figure is even worse in Africa, where only 18% of babies received the hepatitis B vaccine as at 2022. 1.3 million people died of chronic hepatitis B and C disease in 2022. So what's this campaign all about? Hepatitis is a leading cause of liver cancer and a growing global killer. So it's not just that it causes the inflammation of the liver or that it can make the liver to stop functioning. It can also cause liver cancer, a form of cancer called primary hepatocellular carcinoma. Chronic viral hepatitis causes 1.3 million deaths every year, mostly from liver cancer and liver cirrhosis. And liver cirrhosis is when the liver gets damaged and loses some of the tissues. So, and it loses its capacity to function. It's just like having a mass of tissue that cannot really function. So what it means is that 3,500 deaths occur every single day. And this is at par with what you have with tuberculosis, the number of deaths associated with tuberculosis. Hepatitis B and C are spreading silently with 8,000 new infections daily. You know, these two viruses are predominantly sexually transmitted, and you have 8,000 new infections daily. Now, knowing your status is the first step to stopping liver cancer. So may I ask you, when last did you do hepatitis B and C test? Have you ever tested? And if you've ever had a test, when was the last time? Most people living with hepatitis don't know they're infected. But early diagnosis is the first step to assessing life-saving treatments and preventing liver cancer. If you are not aware that you have hepatitis B and C, you won't even take the measures to treat. And if they are not treated over time, especially when they become chronic, they may end up leading to liver cancer. Testing, especially for those in endemic regions like Africa, or those at higher risk, like sexual commercial sex workers and those who abuse drugs, injection drug abusers, even health workers at higher risk. So testing for those at higher risk is critical to ending hepatitis. We can prevent 2.8 million deaths by 2030 if only countries act now. So that's the essence of this campaign, that countries should start acting now. Hepatitis elimination is possible with vaccines, cures, and tools to stop transmission. Yet, most cases go undiagnosed, especially in low-resource settings. Progress requires national commitment, smart investment, and integrating hepatitis care into primary healthcare systems. So what do we need to do? We are here to encourage testing. So try and get tested for hepatitis B and C. We're also here to promote newborn protection. Whenever you deliver, you should ask this very important question. Have you given this baby hepatitis B immunization? Ask your midwife, ask your doctor whether they gave your baby hepatitis B immunization. And we're also here to raise awareness about the link between hepatitis and liver cancer. Most times we don't associate diseases like hepatitis B and C with cancer. But we know that when they remain chronic, when they exist in the body for a very long time, they can lead to liver cancer. We're also here to raise awareness that there's no need to stigmatize against someone with hepatitis. There's absolutely no need. It's just like any other infection, and you don't have to stigmatize. So there are 5 main types of hepatitis virus. Now, the other things that can cause hepatitis apart from viruses like alcohol, sometimes drugs, sometimes autoimmune disease. But then when we talk of viruses related to hepatitis, there are 5 main types. We have hepatitis A, B, C, D, and E. Now, of these 5, hepatitis B and C are the most important because they are the ones that lead to chronic liver disease. Now, the good news is that hepatitis B, which can also be transmitted from mother to child, can be prevented at that stage by making sure that all newborn babies receive the hepatitis B vaccine at birth, and they also continue because it comes in 3 doses. So after the first dose, they also receive the second and the last dose at 6 and 14 weeks. But in adults, hepatitis B is predominantly sexually transmitted. So safe sex practices, prevention of avoidance of illicit sex, and prevention of sexual transmission is one of the ways to prevent the spread in adults. So how do we get ourselves protected? Get vaccinated against hepatitis B. So if you do your test and you are negative for hepatitis B surface antigen, then go and get vaccinated. Use sterile needles and screen blood. Anytime you are to receive an injection anywhere, or you are to receive blood maybe at the hospital, ensure that the blood has been screened and that those needles are sterile right from the pack. Do not reuse needles. Avoid sharing razors or toothbrushes with people around you. Practice safe sex, and ensure newborns get the hepatitis B birth dose within 24 hours. This should be given within 24 hours of birth. Ideally, it should be given before the onset of breastfeeding. And even pregnant mothers should routinely screen for hepatitis B during pregnancy. Now, concerning treatment, according to the WHO 2024 hepatitis report, 50 million people worldwide live with hepatitis C, but only 20% have received curative treatment. So there is a problem of low access, there's a challenge of lack of awareness, and there's a challenge of limited healthcare infrastructure. And that's why we have to focus on preventive measures. Hepatitis C doesn't have a vaccine, so you can only prevent it by avoiding the measures, by putting in the measures I've already enumerated. But when you now get it for any reason, if you get tested early enough and you know that you have it, then treatment can commence so that it doesn't progress to chronic hepatitis C that can lead to liver cancer. So the message is, Let's close the gap. There's a wide gap between people getting infected and people getting treated. And we also have a wide knowledge gap. So the essence of the campaign in 2025 is that that gap should be closed. And that's what we are here to do. So if you are yet to test for hepatitis B and C, go ahead and get tested today.